Thank you. So we're going to start today off with a conversation rather than a presentation. So nobody gets to be a bystander. And before I invite our panelists up, I just wanted to reflect on a little bit of framing that I think Tolu gave us yesterday, which is that in the afternoon yesterday, we spent a lot of time thinking about what she called the colliding epidemics. And now today, we're really turning to what she called the convergent actions. So we were kind of palpating what is the problem and understanding it a little bit yesterday from a lot of new and different lenses for some of us probably very familiar lenses. And today we're really gonna turn to what can we do about it, what can be done. And we're gonna start off with a panel having a conversation that's a very broad lens on that. So, what can be done in everything from healthcare delivery, but also policy, resources, health professional education, the who, the what, the how, kind of running the gamut. After that, we'll have a deep dive into health systems and healthcare delivery and kind of what convergent action looks like there and what that means, and some of the different ways of thinking about that. Some of the ways that are kind of easy to name, but actually much more difficult to understand. So we will have that deep dive, and then we'll come back to some broader thinking about kind of priority actions. So that is the shape of the day, and we have a great panel coming, but as I said, nobody gets to be a bystander today. So first, I was thinking yesterday about how this room really is the choir on this issue. So I've been asked to lead a discussion that focuses on this elephant, but that also thinks about the silos and how we bridge the silos. Maybe because I have Bridget in my name, that's why I was asked to lead this conversation. But I think everyone in this room is in a space where you're already thinking of yourself as outside of those silos. You wouldn't be here at this meeting on convergence if you didn't already have that buy-in. And my usual disposition is to be very positive and very future-oriented, but I actually want us to take a minute to remember what those silos feel like and why. So I'm gonna ask everybody to stand up. I know, grumble, grumble, grumble. Facilitator makes you do stuff. You can't just sit there. And I want you to think to yourself, not what you feel in your heart, not what you know in your mind, but what you're told by the ecosystem that you exist in. And I want you to pick a side of the bridge. So if you are an infectious disease person, I want you to go to this side of the room. And if you are a non-communicable disease person, I want you to go to that side of the room. I'm not asking what you identify as. I'm asking what the world would see you as. Based on how you were trained, who gives you your money, how does the world see you? There is no both option. So just take a minute and think to yourself, like, what were the signals that caused you to have to pick one side or the other? Because those are the things that we want to, those are the things we want to get to, right? The things that are reinforcing the silos. Oh, I'm sorry. So we're gonna take a minute, just think for yourself. Like, what are the signals that have you on the side of the room that you're on? And then we're gonna talk about what we can do about those so that, the reality in which you all exist, where you don't identify as one or the other, becomes the widespread reality outside of this room. That you should feel uncomfortable. Okay, thank you for indulging me in that exercise. And I'm gonna invite Jean and Rachel and Nelson and Dennis to come up and join me at the table. we have to push, just a reminder. Use the microphones. Great. So all of you have in your packets lengthy bios, succinct but robust bios for all of our panelists. And I'm actually going to ask them as part of their first remarks to articulate kind of how they themselves in their own words see their experience and the lens that they bring in the field that they come. So I'm not going to go into lengthy introductions. We have Jean, who comes to us from Harvard Medical School, Rachel from RTI International, Nelson from the African Medical Schools Association, and then Dennis Furnau from USAID, until soon. So we've asked everyone to think about a first question that is pretty broad and open-ended, and each of you is going to take some time to just share some remarks in response to that first question, and then we'll pick up on a few follow-ups from there among the panelists, and then we'll open it up and have some time for all of you to think about that sticky, problematic thing that made you pick which side of the room and what questions you have for this panel about solutions they have in mind for that. So the first question is, first of all, please do start your remarks by saying a little bit about who you are and what lens you bring to this question of the convergence between infectious diseases and non-communicable diseases. And then share what you see as the key opportunities that you've observed to address this convergence. And you might be philosophical, but it helps if you're also concrete. So a little mix of those two things would be great. You want to start, Jean?